Saint Thomas Health Services offers Middle Tennessee some of the most technologically advanced diagnostic and treatment equipment in the country. But when Marion Steed turned to the brain lab at St. Thomas, she wasn't looking for technology, she was looking for relief.
Something over 10 years ago, I started having these tremendous pains in the face, and the first time it ever hit me, it was like a really big electric shock.
Ms. Steed was diagnosed with trigeminal neuralgia. A blood vessel was pressing on a nerve in her brain. After 5 years of life-altering pain, she had brain surgery. The pain abated but returned 5 years later.
When she came to us, she even had some pain patches on both sides of her face and was still miserable, to the point that really, I would say, her quality of life was close to zero.
She underwent radiosurgery treatment in the brain lab.
So I came in one day for the full day, and they set me up, to do the radiation, and it was just an experience. Really, it's painless. Amazing, and you walk out the end of the day, you don't know you've had anything done.
The Novalis-shaped beam radiosurgery used on Ms. Steed is changing and saving lives.
What that allows us to do is very accurately and very precisely deliver a fractionated or broken up dose of radiation to targeted specific areas in the brain that we otherwise can't or don't want to reach. We're able to deliver a very potent treatment to areas we would not have gone before.
But not to have any pain is wonderful, and of course when you've got that severe pain you can't eat properly. So I did lose weight, and I lost quite a lot of weight, and I'm still trying to put it back on. I think my biggest joy is eating. It's lovely, it really is.
The brain lab physicians and caregivers take a team approach to treatment, and that's improving patient care.
It's not only a neurosurgical decision, but now it's become a working brain tumor group. In fact, we meet once a week and prospectively review patients and their cases and have an interdisciplinary discussion in cases that I used to not have anything to offer. I used to say, I'm sorry. Whereas now we have specifically stereotactic radiotherapies and radiosurgery, and our brain lab program has opened the gamut as to what we have to offer patients.
Neuroscience also runs the gamut throughout St. Thomas Health Services hospitals.
We have programs for patients and community members with MS, ALS, people who have experienced stroke, brain tumors, people who have back and neck problems, people needing rehabilitation for fall prevention, dizziness, balance issues.
STHS hospitals are experienced in the treatment of stroke.
St. Thomas Health System is the largest provider of stroke care in Middle Tennessee. We have over 1,000 patients with stroke a year in our main hospitals, Baptist, St. Thomas, and Middle Tennessee.
Those system hospitals are all stroke center certified, raising the standard of care.
The evidence-based proven therapies for stroke are going to be provided to the patient if those are appropriate. It means that things are much less likely to sneak through the cracks or be overlooked.
STHS also has new neurotechnology called biplane angiography, saving lives by allowing physicians to see small blood vessels with incredible clarity.
This has allowed us to treat patients that we could never have treated before, and to avoid surgeries in many cases where we would have to have operated on patients with open surgery in the past.
This technology allows physicians to retrieve stroke-causing clots within the brain by going through the arteries and vessels.
In fact, we've saved a couple of patients that we would not have attempted before because our ability to see these blood vessels has increased so tremendously.
STHS has also partnered with the Howell Allen Clinic to create the Center for Spinal Surgery, an integral part of neuroscience services.
It's a center where we focus our care toward the surgery of the spine. Both neurosurgery and orthopedic surgeons are operating there. We're doing about 300 operations a month, anything from very simple lumbar discectomy type operations to more elaborate fusion type procedures.
Many of these procedures are done on an outpatient basis. Another joint venture is the new St. Thomas Health Services Center for Sleep. It's the largest sleep disorder center in the region. This state-of-the-art facility merged centers at St. Thomas and Baptist. The sleep center has a hotel-like atmosphere designed to put patients at ease.
We see patients here who have a variety of different problems with their sleep. Many of them have something wrong with their sleep that may affect the way they function during the daytime. And so by observing them here with a variety of different monitoring devices we have, we can delineate what those problems are and how severe they are, and then try to come up with a solution that will allow people to function better during the daytime.
During a sleep study, the patient is connected to a variety of monitors, including brain waves, breathing patterns, oxygen levels, and heart rhythm. If linked to other health problems, a sleep disorder may pose a serious health threat. The Center for Sleep takes a team approach and brings together experts in a variety of fields to address a wide range of sleep disorders.
There are now enough doctors who study patients with sleep problems primarily that we've been able to generate physicians in the community who think of themselves as sleep specialists. And a sleep center like this is an important facility for them to use for their diagnostic tests to try to figure out what's wrong with their patients.
From sleep disorders to stroke care and the latest in brain disorder treatment, Saint Thomas Health Services is a leader in patient care and neurotechnology, making a difference in the lives of people throughout Middle Tennessee and the Mid-South region.